afternoon. My name is Olivia Stovall, and for my ASP project, I decided to evaluate the relationship between a poor access to healthcare and the economic condition of women. Meaning that I looked into how women in areas that predominantly contain barriers to accessing healthcare are financially affected by this occurrence. To give some context into what led me to this topic, my personal connection is that I want to pursue a medical profession. Although what it is still very flexible, I have always been drawn to medicine and the act of sustaining health for others. Locally, I was drawn to this topic because of my participation at Treasure Coast Girls Coalition, which is a nonprofit organization based in Sebastian that focuses on serving underprivileged girls, usually around the middle school age as well as high school age. My recent participation with them has strengthened my view on the challenges that girls can face when they lack equal access to resources. And lastly, nationally, women's healthcare is clearly a national topic. In a peer-reviewed research article that I found that focused on women's access to primary care, it stated that in 2020, U.S. women earned 84% of men, as measured by their median hourly earnings in both full-time and part-time jobs, which means that if a poor access is directly connected to a woman's economic condition, then this gap will only continue to grow as time goes on. For the scope of this project, I decided to focus on rural areas. A rural area is defined as a place with low population density and open spaces. 24% of rural residents in rural areas rely on Medicaid as a form of insurance. In some states, over half of the population that is on Medicaid rely in rural areas. In New Mexico, Louisiana, Arizona, Florida, South Carolina, and Arkansas, at least half of children in small towns in rural areas are covered by Medicaid or some form of children's health insurance program. In 15 states, at least 1/5 of non-elderly adults living in small towns in rural areas are covered by Medicaid. So, for the purpose of this project, I have focused on socioeconomically disadvantaged women in rural areas. According to the Harvard Medicine magazine, after analyzing the 2010 U.S. Census, it was concluded that 77% of rural U.S. counties are considered healthcare deserts. In findings by the March of Dimes, which is a national nonprofit organization that focuses on improving the health of mothers and babies, it was concluded that 35% of U.S. counties are considered maternity care deserts. Furthermore, the U.S. Government Accountability Office states that roughly 1 in 5 U.S. residents live in rural areas where these shortages are most severe. This means that roughly 60 million Americans may live in areas where they are required to travel greater distances just for common medical care and checkups, and even further for specialized care, as opposed to someone who has minimal barriers to accessing health care. Because we're focusing on women's health care, the main specialties include the following: gynecology, which pertains to functions and diseases that specifically affect women, usually encompassing health complications of the female reproductive system. Obstetrics, which specifically concerns medicine and surgeries focused on childbirth, dealing with the woman in maternity, as well as her prospective infants. And additionally, gender-specific healthcare, which focuses on the differences between how males and females are affected by similar conditions. For the scope of this project, I've decided to focus on obstetrics, which I will often refer to as maternity care because, unlike the other sectors of women's health care, obstetrics focuses on 2 individuals, including the woman and her child, whereas gynecology and gender-specific health care mainly focus on the individual. So in order to examine the relationship between a poor access to health care and the economic condition of women, the main focus will remain on obstetrics, as it is a relatively common occurrence for health complications to occur during a woman's pregnancy as well as in her postpartum period. Concerning statistics as of 2022, identified by the Commonwealth Fund, which is a national organization whose mission it is to improve and promote a better quality and access to health care in the United States, concluded in an analysis of numerous high-income countries that the United States has a significantly relatively high maternal mortality rate. The maternal death rate is measured by the average number of deaths of women for every 100,000 live births. As shown, as of 2022, France's maternal death rate was 8.0. The United Kingdom's was 13.41, and the United States' was 22.3, which is actually a stark decrease from 2021 when it was 32.9. Another concern is that 2/3 of the United States' pregnancy-related deaths occur postpartum period. suggesting that the United States' high maternal mortality rate may be attributed to women's health care or lack thereof after childbirth. Now to delve into challenges in women's health care. It's important to acknowledge that the study of healthcare has historically been primarily from men's perspective as opposed to women's. Access for women to a female doctor has existed for less than 200 years, and only in recent periods have low-income women been able to access medical care for women researched by women. One of the barriers in women's healthcare is the challenge of whereas medical research has been historically from the male perspective for thousands of years. Now, one of the barriers in women's healthcare is the challenge of translating research into practice. Mortality rates for women have declined in breast cancer, heart disease, and cervical cancer. However, there remains limited research in progressing and researching women's health conditions and in reducing disparities among different groups of women based on race, ethnicity, and age. In 2010, a book published by the Institute of Medicine and the National Academies Press was discussed that a significant challenge to providing accessible health care lies within the translation of research into practice. Research is a tremendously important part of healthcare, as failure to report gender-specific findings can result in delays in standard of care treatment for women. However, contrastingly, hasty findings can directly harm women. For example, the conclusion to utilize the transplantation of autologous bone marrow for advanced breast cancer in the 1980s was later shown by research to actually increase the risk of health complications. It is important to recognize that the dearth of research in women's healthcare has a direct impact on the ability to practice women's healthcare. Revisiting previous concerns of healthcare deserts and maternity care deserts, analyzing the what and why, and can help us in discovering who is affected by these deserts and how it affects them. Healthcare deserts are areas where people face severe barriers to obtaining medical care, and they form when communities experience a combination of facility shortages, high hospital operating costs, and a lack of medical professionals. Maternity care deserts are similar to healthcare deserts, however, there are significant barriers in accessing obstetric units and childbirth centers, specifically with a lack of OBGYNs, qualified nurses, and midwives. The consequences for women, especially those of childbearing age, are severe, as these deserts can result in increased travel distances for care. In many rural communities, the nearest hospital offering obstetric services may be 20, 30, or even 40 miles away, and this means that a pregnant woman might have to spend hours traveling just to attend routine prenatal checkups. For those without reliable transportation, the challenge is even greater and can sometimes result in skipped appointments altogether, which increases the risk of serious health complications for both the mother and her unborn child. Maternity care deserts can also contribute to higher maternal and infant mortality rate, as a lack of reliable access to care can directly increase the risk of complications during pregnancy and childbirth. For example, women experiencing symptoms of preeclampsia, hemorrhages, or preterm labor may face delays in receiving emergency care. The United States already has one of the highest maternal mortality rates among high-income countries, and these access gaps are a key reason why. Another concern regarding healthcare deserts and maternity care deserts is that they reduce physical access for all patients, regardless of financial status, which means that having health insurance doesn't help if there is no facility nearby or no provider willing to take new patients. This means that even insured women face challenges when getting basic prenatal care, screenings, or postpartum follow-up visits. For women, particularly those living in rural communities, these deserts mean longer travel times for prenatal appointments, a higher risk of medical complications, and sometimes missing care and checkups entirely because of the significantly farther distance required to access adequate care. These gaps in care do not just threaten health, but they also have significant economic consequences. Missed appointments and delayed treatment can result in health issues that may force women to take more time off work, reduce their hours, or leave the workforce entirely. For single mothers or women in low-wage jobs without paid leave, this can quickly spiral into lost income, job instability, and long-term financial hardship. Additionally, health complications for pregnant women may lead to health challenges for their newborn child as well, which would require frequent medical visits and checkups. Additionally, the more women who miss appointments and have delayed treatments also contribute to reduced revenue for hospitals and obstetric units, continuing the cycle. From 2011 to 2023, it was reported that 217 hospital obstetric units were closed across the country, which has greatly contributed to the acceleration of the creation of maternity care deserts. The causes of these closures include declining birth rates, as many hospitals justify these closures by reporting fewer births in their area, which makes it harder to cover the operating costs. Another cause is staffing shortages, which specifically means difficulty in recruiting, sustaining qualified OBGYNs, nurses, and midwives, which is a growing challenge, especially in rural and underserved areas, because of the lack of incentive to work in rural areas with lower populations. Additionally, the current trend towards regulating women's health care may serve as a deterrent to future and current medical professionals from entering politically litigious environments. Additionally, cuts to Medicaid reimbursement rates and eligibility may directly reduce hospital revenue, as a significant portion of rural residents rely on Medicaid, making it financially unsustainable to keep hospitals and obstetric units open. In the United States, maternity care is billed as a global package, which means that insurance covers prenatal visits and delivery, but often not the pregnancy detection stage or a significant portion of the postpartum period. This is concerning, as most maternal deaths happen postpartum, and furthermore, for women without full coverage, paying out of pocket for complications is often a financial burden. Medicaid provides postpartum care for most women up to 60 days after childbirth, with some states extending coverage up to 12 months. This is vital, as many pregnancy-related complications and deaths occur well after delivery. However, currently pending legislation will make it more difficult for people to enroll in Medicaid, possibly leaving scores of women uncovered throughout their pregnancy. Reducing the number of individuals enrolled in Medicaid will not only affect mothers and make them pay out of pocket or possibly miss care, but it also affects hospitals, especially in rural areas. The financial strain can lead to obstetric unit closures, deepening healthcare deserts, and further limiting access to maternity care. Medical care providers in rural areas who service patients heavily dependent on Medicaid coverage as a primary form of insurance will suffer from a lack of income. Additionally, hospitals with emergency rooms will face intense consequences, as federal laws require hospitals to treat patients regardless of whether or not they can pay. This means that if a pregnant woman experiences a medical emergency and are not covered by Medicaid, hospitals will be required to treat them regardless of the fact that they may never receive adequate payment. For the patients themselves, these policies may result in missed treatments, screenings, and checkups, and this can directly lead to reduced work capacity due to unmanaged health complications. Poor access to gender-specific health care affects women's careers in many ways. Planned Parenthood provides women with numerous preventative care measures such as contraceptives, STI testing and treatments, cancer screenings, and vaccinations. They also provide support in the form of education and counseling. Limited preventative care often means that health issues can go undetected until they become serious, leading to more sick days and reduced ability to maintain consistent employment. In rural or underserved areas, getting basic prenatal treatment can be difficult due to distance, time, and cost, which can potentially lead to infant health complications. This would require frequent care and flexible schedules, which can be financially detrimental, especially for single mothers. The number of hours a woman works can greatly affect her career development. When these healthcare challenges reduce a woman's availability, many shift from full-time to part-time work, which often results in a loss of employer-provided health insurance, few opportunities for promotion, and slower career growth. Over time, these setbacks translate to lasting wage penalties. The outcome is a cycle where poor access to health care leads to reduced work hours, which lowers income and benefits, further limiting access to the care needed to remain healthy and sustain an sustainable income. The Duke University Press noted that on average, parenthood negatively affects women's availability to work, but positively impacts men's availability to work. And additionally, insurance coverage is essential for women in maternity and for people overall because it directly impacts their health and economic stability. As suggested by the Journal of Health Economics, access to health insurance can lead to increases in labor supply by reducing the financial and logistical barriers to receiving care. When individuals know they can afford medical treatment without facing overwhelming costs, they are better able to maintain their health, remain in the workforce, and sustain consistent employment. This is especially important for low-income single mothers, possibly in rural areas, who are not able to rely on health insurance from their spouse and may not have employer-based health coverage. The conclusive connections I found in this project are that firstly, obstetric care has the greatest impact on a pregnant woman's economic status as it directly affects her health, ability to work, and career continuity. Secondly, single mothers are especially vulnerable to facing career challenges when access to health care is limited. Without consistent obstetric and postpartum care, they may encounter health complications and increased caregiving demands, leading to missed work and reduced opportunities for professional growth. And lastly, legal and regulatory policies greatly influence how hospitals function and their capacity to provide obstetric services, which in turn affects both the maternal health and economic opportunities for women. To conclude my project, Healthcare Deserts, which can be attributed to hospital and unit closures and increased difficulty in affording healthcare, directly impacts a pregnant woman's financial condition, as they directly hinder her ability to sustain work hours and further career development. Thank you.
Panel.
I think this is such an important topic. I mean, kind of an understatement. But I appreciate that you took on something that is so important that gets glossed over completely. And I wrote down, one of my notes is just, it's a basic human right. And in the United States, I can't even believe that this is happening. And I appreciate that you're working with and bringing to the surface such an important, life-changing topic.
Thank you.
It's really powerful.
Yeah. Actually, under one of the sources that I used a lot, which was the Commonwealth Fund, and their study of the numerous high-income countries, while I saw lots of statistics that showed that America had high maternal mortality rates and low numbers of OBGYNs and midwives compared to these other high-income countries, one of the significant statistics that I saw was that out of all of these high-income countries, the United States was the only one that did not have federally mandated paid leave for maternity care. So I think I didn't touch on that as much in my presentation as I did on my paper, but I think that is a significant part in this.
Olivia, thank you. Great presentation. That, I'll tell you, the one that got me was the statistic that we talk about, the mortality rates, and France at 8.0. I'm kind of curious as to, there are parts of France that are rural. How do they do it? How are they able to do something we are not able to do?
I didn't completely look into other countries in a total comparison, but I do know that obviously the United States and France have very different geographical and population situations. Sort of answering your question, one of the things that I noticed about the United States is that there's a big difference in population growth and growth of qualified OBGYNs and nurses and midwives. For example, the average retiring age for an OBGYN is 59, and the average age of a current one is 51, whereas there are constantly women in the United States who get into their childbearing age and either experience planned or unplanned pregnancies. So I think that while France and the United States both have many rural areas, I think it's more of the population difference in growth and population of medical professionals that are able to.
So just to piggyback on that, my first question, as far as you're concerned, when you were doing this research, did you think of any ways that we can solve this problem? Are there things that you said, well, why aren't we doing this?
I think the main issue is, well, not the main issue, but one of the bigger issues is that there simply are just not places for people to go, or they're a significant distance, and then there arises the issue of transportation. While many people don't have the option to choose where they're located or change where they're located, I think the biggest thing is, rather than spending a bunch of money and placing hospitals here, placing units here, or spending a bunch of money and having people move elsewhere, I think a good first step is simply being aware of where your nearest hospitals are located, where, like, keeping in touch with other people who are able to help you get transportation if you need to. For example, this isn't specifically related to maternity care, but my mother had cancer when I was in middle school, and she had to take frequent trips to Tampa, taking time off work and such to get checkups and treatment. And my father isn't very part of my life, but my mother's boyfriend has always been a very big part of my life. And so I think connections like that, he was able to drive her to see these appointments in hospitals. And I think while transportation and distance and cost can be a very big issue, having local support is a good starting solution.
Thank you.
I like how you, again, with the comparative aspect to other countries and this idea of paid leave, and yeah, in other parts of the world they do a lot better. Now I have a friend in Australia, and she got a whole year of paid leave from her work, and it was encouraged by her employer and so forth. So I was wondering if you had heard about it recently here in Indian River County. They're thinking about shutting down the maternity ward at Cleveland Clinic, citing funding issues. And so I was wondering if any of that came up in what you were studying, given that it is so recent and it is our area, and what your thoughts were on that.
My out-of-faculty mentor, Dr. Crawford, gave me I talked with her and she gave me some thoughts about looking straight into Indian River County, because there are lots of public records and discussions about, for example, the maternity mortality rate in Indian River County. I didn't specifically look into our area. I mainly focused on rural areas all around the country. But I definitely would like to see what's happening even at our local stage, because while this is like a very broad topic that encompasses the entire nation, it also is relevant in every single household for the most part.
A couple of things in your presentation. I want to ask you about the repeated reference to the shortages of OBGYNs. Do you know why there's a shortage of OBGYNs?
It's not a direct one reasoning. Kind of like I said earlier, it's less that there is less OBGYNs, but more that there's too many people that require OBGYNs, especially since OBGYNs are one of the most sued medical professions.
I was about to get to that. That's one of the issues that's leading to the shortages, that the highest medical malpractice is in OB obstetrics especially. And we have one of the highest rates of C-sections in the world. Did your research show you that as well?
I did not highlight on that, but that.
The other thing that you didn't reference in the medical deserts, you learned about deserts, food deserts, and human geography, and medical deserts. These are all part of the same issue. One of the issues with medical deserts, it's a problem. Another problem that we're facing from my side of looking at this same topic is education and women in education. Can you tie in education and the issue that you're discussing with some of these medical issues, and how education might improve some of these statistics?
Yes. Sort of like I said earlier, while there is a shortage of people, places, and money, I think, like you're saying, being aware and being educated on topics. For example, Planned Parenthood, that provides lots of services for young girls and women. Being educated in planning pregnancies is a big part of, obviously, maternity care deserts wouldn't be as big of a problem if there were strict planning on when women were getting pregnant, but it's clearly a issue on unplanned pregnancies or surprise pregnancies. Kind of, for example, I myself was a surprise pregnancy because my mom thought she was infertile, but she...
Surprise!
Yeah. But I think being educated in sexual activities as well as your surrounding area, for example, just being aware of what medical facilities are in your area having people that also know where medical facilities are in your area, because if you are having an emergency, it's difficult to get yourself there on your own. I think the most important thing is being educated on what's in your surrounding, what you have access to, and possibly what you can gain access to.
That's the IMRs that you learned, that acronym in human geography, is tied into what United Nations studies have shown over and over again in countries of all economic levels, is tied in heavily to education and the degree of education of the population that you're dealing with. I don't refute your argument that there is a problem with access to healthcare in this country. I think that is a really serious issue, and I'm glad that you're putting that forth. I just think that we also have to keep in mind that there's another crucial issue that we're dealing with, and that's a lack of education. That's a crisis, and it's why we have, as a rich country, such a high infant mortality rate. It's disgraceful, actually, on an international level, that this country, with one of the biggest economies in the world, has the IMRs that we have. But it's primarily located in the inner city and in rural areas. That's where you see it. That's my questions. Anyone else?
Yeah, so for the death rates, I wanted to ask if you saw any data that teased out different ethnicity groups. Was that higher in one versus another?
Yes, actually in the same study I found an exact data table that listed exactly that. To give reference, I don't have it on my presentation, but it scaled from the lowest maternal mortality rate to the highest, and at the highest was U.S. Black women, and I believe it was around 50. Then following, I believe
50 per 100,000.
Yes, 50 per 100,000, while the United States was 22.3. White women in the U.S. was in between the United States' average and Black women, and then Asian women was on the lower end, smaller than 22.3, I believe at 14.3. The only country that was in between Asian women in the United States and the United States, I believe, was Chile.
And so you're kind of talking about this positive feedback loop that leads to very negative consequences, and it made me think about generational trauma. So can you speak on how getting in a situation like this, where you have an unplanned pregnancy in a rural area, could lead to something like that, or how people in rural areas could be in these generational traumas of, this is what has happened, so this is what I'm going to do also?
I agree with the idea that generational trauma can definitely occur from this, especially in the case of where there is health complications and financial burden, where, going back to Mr. Mitchell's question, the problem of education in that environment becomes a problem, especially in rural areas. I believe that if a child is born into a situation of financial instability as well as medical complications, let's say that the child, I didn't particularly go into this in my research project, but when talking with my out-of-faculty mentor, we talked about the uprise on congenital syphilis in infants, which can mainly be attributed to just the lack of testing for syphilis and then having a child that is born with it. So, for example, when a child is born with these health complications in a financially unstable environment, then I think that generational trauma can definitely occur through all of those hardships.